To prevent the virus from spreading even further, a local fire department has set aside an ambulance specifically for emergency calls regarding COVID-19. Local 23's Joanna Guzman spoke to a specialized team member and brings us the latest.
The Weslaco Fire EMS department has a new response team dedicated to infectious diseases. Their first operation, COVID-19.
So what we did was we took one of our support units, added all the personal protective equipment on it, and now that unit is going to respond first to anybody who could possibly have any signs or symptoms of COVID-19.
Today, Governor Greg Abbott suspended regulations to increase emergency medical services, allowing those not certified to perform medical care during the pandemic.
Well, we're just trying to give people a sense of security. We've taken the
Weslaco Fire Lieutenant Rich Stubbs says although his team is certified, they weren't anticipating to launch the unit this soon.
So if we hear a fever call, then we're going to send that IDRU team member out there to actually talk to the person and see if they meet the criteria.
With multiple cases confirmed in Weslaco, Stubbs says the department wants to assure hospitals are not overwhelmed and are doing everything to prevent the spread.
So these calls, when we get to the ER, we've already notified them ahead of time. They can put their personal protective equipment on. That way they can receive the patient, make sure that there's not any other patients that are vulnerable in the area.
Stubbs adds there is only one ambulance assigned to respond to all COVID-19 related calls.
We're just trying to isolate all these type of calls to one unit to keep our response time on regular calls faster. So really the only difference is sealed off compartments.
Stubbs says the special response unit is wiped down after every patient. Adding a fogger with bleach solution sits in the ambulance for 20 minutes before taking the next call. In Weslaco, I'm Joanna Guzman, Local 23 News.